The chair now recognizes Dr. Miller-Meeks for 5 minutes for questions.
Thank you, Mr. Chair, and I thank our witnesses for being here and testifying before the committee today. I'm proud to see my bill, H.R. 3226, Premium Reauthorization Act, included in today's hearing, and I thank Ranking Member Eshoo as well as Representatives Kelly, Blunt, Rochester, Burgess, and Kiggins for their hard work on the legislation. As a mother and a physician, I understand the harmful health implications of preterm birth and recognize the importance of public health programs like PREMI, which seek to address the root causes, also because I was the director of the Department of Public Health. In 2021, Iowa mothers gave birth to almost 3,700 preterm babies, which represented 10% of all births in the state that year. Not only do preterm births pose great health risks to the mother and her baby, but they are very costly to the healthcare system, as was alluded. Over 28% of infant deaths are preterm related, and the average cost associated with preterm births in Iowa is $58,000. Dr. Shiro, in your written testimony, you state that almost 2/3 of pregnancy-related deaths are preventable, and that preterm birth rates worsened in 38 states between 2018 and 2019. Can you please explain how reauthorizing PREMI will help reduce those rates and how funding will be used?
So first, the financial impact of preterm birth on the U.S. economy and families. Medicaid pays for 40% of all deliveries, and an estimated 40% of medical costs associated with preterm birth has a significant impact on both federal and state budgets. What we are trying to advocate for here is more research to go into more solutions that will solve for the preterm problem in this country that you just alluded to or highlighted and have dealt with in the neonatal intensive cares across this country. And the point of this is to be able to collect that data to translate those into real actions.
Thank you. I'd also like to speak in support of Congressman Crenshaw's legislation to reauthorize Children's Hospital GME. The Republicans wish to reauthorize this. It's the parties on the other side of the aisle that wish not to. I know firsthand that a physician's training is a lengthy and expensive process, which is why renewing CHGME to ensure that there is sufficient supply of pediatricians to meet demand is so important. The timely reauthorization of this program through 2028 will continue a legacy of over 20 years of supporting our healthcare providers. However, I'm also supportive of a ban on funding for hospitals that furnish puberty blockers, hormone therapies, and surgeries for the purpose of altering biological genitalia to minors. So, Dr. McNamara, is an XY chromosome assigned at birth?
I'm sorry, I don't understand the nature of your question.
Simple question. Is an XY chromosome assigned at birth?
We often don't do routine chromosome testing on infants.
So an XY chromosome would not be assigned at birth, nor would an XX chromosome, although you say that sex is assigned at birth. There's a lack of scientific evidence regarding the effectiveness of these medical interventions, especially among minors, which is why countries in Europe, such as Denmark, Britain, Sweden, have described treatments as experimental and are urging doctors to proceed with caution, and why they've changed their guidance. The purpose of healthcare is to treat and heal, and it's not of interest at the expense of physical and mental well-being of patients. What evidence, Dr. Grossman, do we have that the thriving Dr. McNamara talks about is because of hormones or surgery and psychotherapy, family support, regression to the mean, placebo effect, or some other confounding variable? After all, there have been no randomized controlled trials. Have there been randomized controlled trials, Dr. McNamara?
There have not. Randomized controlled trials are what are the gold standards. That gold standard, that is what we're always looking for in medicine. We do not have those kind of studies. As you said, there are variables, confounding variables that can interfere. If a child is going through these gender-affirming cares, so-called, the child may also be getting psychotherapy. The family may be getting support. How do we know that the improvement on the other side is due to the hormones or the surgeries or the psychological support?
Yeah. Thank you. And I think to say that the federal government is not already involved in healthcare is either naive or disingenuous. We saw that throughout the pandemic, that federal and state governments were both involved in the doctor-patient relationship. As a veteran, I defended the right the constitutional rights of Americans. As a doctor, I swore to do no harm. Because I care about the physical and mental health of your children as much as I do my own
Thanks.
children, I support restricting federal funding for experimental care that is permanent and
Gentlelady's
irreversible
time's
in minors.
expired.
Thank you. I yield my time.